Good afternoon, everyone. My name is Elton Noswood. I am a Senior Program Analyst with the Office of Minority Health Resource Center. We are very happy today to be able to collaborate with the Northwest Area Indian Health Board and a presentation today with their colleagues and partners on the Healthy Native Youth, a one-stop shop for educators who want to expand learning opportunities for the American Indian Alaska Native youth. Next slide. So the presenters today include Tommy Gostog Jr., who is the project assistant with the Northwest Portland Area Indian Health Board, Stephanie Craig Rushing, who is the project director of the Northwest Tribal Epidemiology Center with the Northwest Portland Area Indian Health Board, as well as with Jennifer Torres Jones, who is a research coordinator at the University of Texas Center for Health Promotion and Prevention Research. We also have joining us today Nicole Tewitt, who is a Senior Professional Research Assistant with the Centers for American Indian and Alaska Native Health at the Colorado School of Public Health. We also have Amanda Gaston, who is also with the Northwest Portland Area Indian Health Board. And finally, we'll end our presentation today with David Stevens, who is with the Northwest Area Indian Health Board. Next slide. Our agenda today are going to be with presentations on the youth health tech trends, the web portal of the Healthy Native Youth, and some of the programmings that are available through the web portal, which include Native It's Your Game, Circle of Life, concerning school media post trainings, and We Are Native text messaging. And for our participants who are online, if you have any questions, feel free to text those in the text box, and we will be able to present those questions at the end of the presentation for our presenters. Again, if you have any questions during the presentation, please type those in the text box, and we will have the panelists address those questions at the end of the presentation. And without further ado, I'd like to have Mr. Tommy Gostog be able to present our first section.
Hello, everyone. My name is Thomas Lee Gostog Jr. I'm an enrolled member of the Burns Paiute tribe, which is located in Southeast Oregon. I'm also Ogallala Lakota on my dad's side, and I am the Project Red Talent Assistant here at the Northwest Portland Area Indian Health Board. I also specialize with our adolescent health program, We Are Native, which is an online media resource for Native youth by Native youth, and I specialize more so in leading our 150 We Are Native Youth Ambassador program. Thank you for being on this webinar, and to start off the webinar, we want to share with you some youth trends and some numbers that we received from a survey we conducted in 2016. Next slide. So in 2016, we conducted what we call the Youth Health Tech Survey. And what it was a survey around technology and health. And we targeted three main events that youth are at. And so those three main events, excuse me, that youth were at, the first one was the National Unity Conference, which is a conference held every summer that has, well, this last year had about, almost 2,000 Native American youth in attendance. So that was the first big event that we targeted with disseminating this health tech survey. The next event was our own youth conference, our Thrive conference that is held in Portland, Oregon at the end of June, and there were about 75 attendees in that conference as well. And then the third place that we disseminated this youth tech survey was at the Chemawa Indian Boarding School, which is located in Salem, Oregon. So as you can see on this slide, it has a good representation of the population and the numbers of where those youth participants were from. And in total, we had a number of 679 respondents. And as you can see, Arizona was our #1 state, followed by the state of Washington. So these next few slides will be some numbers that we have from this youth tech survey, but also numbers that we feel are important to share if you work with Native youth or they're your target audience, and ways to reach them where they're at. Next slide. So with this slide, it kind of just breaks down the numbers and the gender distribution through this through the health tech survey that we had, and I really like to point out the age range with 59% being 19 to 24-year-old. Our services do provide to the 13 to 24-year-old age range, but in this particular case, we're pretty excited that 59% were more so in the 19 to 24-year-old age range. Also, 100% of the respondents were American Indian or Alaska Native. Next slide. And here we created a pictograph of what health topics are important for Native youth to learn about. So as you can see, these were all the topics that Native youth felt or they wanted to know more and have resources pertaining to these different health topics. And it's also interesting to point out that after the survey was completed, we had input from several youth at several other youth events that sleep was another health topic that the Native youth really wanted to learn about, and having, learn about the sleep patterns and getting enough sleep. So definitely sleep was added to that list of the health topics that are important to the youth. Next slide. So as you can see, the question was, what % of Native youth say they do the following on a daily basis? And for a while, it was a misconception that Native American youth were not, finding service or getting online. But as you can see from our survey, 76% go online from a phone or a mobile device. Native American kids will find service or try to find Wi-Fi so they can, log into their Facebook or check their Instagram or post a Snapchat, which you can see that Snapchat, Instagram, and Facebook are the top 3 platforms that Native American youth are using. And the other numbers kind of describe what they see on their Facebook or what they see on their social media. And I really want to point out the help and support. So 24% experience people supporting them through tough times on social media. So we really want to increase that number. Because as you will learn in this webinar, Native American youth are going to social media to express the way they feel. So yeah, next slide. And with this last slide that I will be presenting, where do Native youth say they get a lot of their health information from? So as you can see, 36% of Native American youth say they get their health information from a social networking site. So we really want to meet the Native youth where they're at and where they're accessing information and providing them medically accurate health information. As you view this slide, you can see at the bottom that only 19% of the Native youth get their health information from a school or health class. So we really want to be the leader in providing that medically accurate health information for youth and really meeting them where they're at through their social media platforms. So thank you for having the time to see some of the youth trends that are going on today. And with that being said, I will pass it to Dr. Stephanie Craig-Rushing. Next slide.
Thanks, Tommy. This is Stephanie. I work at the Northwest Portland Area Indian Health Board along with Tommy and David and Amanda, and we have been working on a variety of different adolescent health promotion projects, a few of which we're going to share today. And if you click over to the next slide, you'll see one of the newer resources that we have been working on. As Tommy was saying in his last slide, only 19% of youth say they get medically accurate health information from school, and we as health educators, of course, felt a little concerned about that and wanted to help support educators and health professionals to deliver that culturally appropriate information in school settings. And we're realizing that it was kind of difficult to locate those. The really exciting news is that communities and tribes across the country have been collaborating to adapt programs, but they were very dispersed. And so we recognize that in order to be effective, health curricula must be age appropriate and culturally relevant and reflect the values and learning styles of the learners being taught. And so we really wanted to design a website that could help teachers and educators locate those curricula and serve as a one-stop shop for folks to support education among teens and young adults. Next slide. So we won't feel sad if you click over to a new web browser and open up the website and surf as we chat, because it's really a, I think, fun and kind of interactive space that you'll have to spend some time searching around. We're only going to share a few of the programs that are available on the site, but in total there are now 8 culturally relevant programs that have been added to the site. Most of them focus around sexual health topics, but there are other curricula being added to the site that focus on other health promotion topics. And really the goal is really to find programs that support healthy decision making and empower teens to make healthy choices. And so those are the programs that we're looking to add to the website. So from this curricula tab, you can click on the name of a program to learn more about it, including the intended age group, where it can be implemented, and how much time is required to implement each program. They kind of range from 1-hour lessons all the way up to 29 lesson programs. So you'll probably have to, depending on the needs of your setting, and the constraints that you have, choose a program that is appropriate to your setting. Next slide. So these are some tools that will help you in that searching process. You can filter your search by the particular age group that you're working with, whether the program is LGBT and Two-Spirit inclusive, what setting the program has been delivered in, whether it is a school-based curriculum or after school, or can be flexibly implemented in a variety of settings. And we know that some communities are required to implement programs that meet a certain level of evidence for certain funders. And so if you need to select a program that is either a best practice or promising practice or a tribal best practice, you can search by those criteria also to find programs that meet those criteria. Next slide. And then this page allows folks to compare one or more programs to each other, kind of side by side, on some other criteria like class size or cost or program duration. So this will also help you compare programs and select a program that best meets your community's needs. Next slide. Once you've selected a program, so for example, if you select the Native Voices curriculum, this particular intervention is a 23-minute video intervention designed to encourage condom use and STD testing among Native teens and young adults. You'll start with kind of a cover page with information about the program, and then you can see within each program different folders related to that curriculum. So this example includes the training, lesson plans, supporting materials. There's information about its cultural relevance, the adaptation process, or the process of creating the original program to maintain cultural context. There's also a section about the evaluation and how it was evaluated, and then references like community reports and journal articles or any publications related to that particular curriculum. And from the training tab, you can get usually videos or webinars that will prepare you as an educator to implement the curriculum. So that's a good place to start to kind of get a little overview of what it takes to implement the program. And then from the lesson plans page, you can download a zip file that contains all of the program materials in all of the folders. So you don't have to download the lesson plans, the teacher's guide, participant manuals. All of those things can be downloaded in a single zip file from that lesson plans page. Next slide. This site also has a list of adolescent health resources and tools for educators, some links to resources for youth, some social marketing campaigns that have been designed to promote adolescent health for Native teens, links to those campaign materials. So just a variety of different resources for educators to promote adolescent health in school or community settings. Next slide. So we are really actively on the lookout for new curricula to add to the site. If you happen to have a health program that you would like to share, whether it's on nutrition or tobacco prevention or drug and alcohol prevention, we would love to partner with you to add other curricula to the website. There is a tab at the top of the website that allows folks to submit new programs, and we're looking for all sorts of topics to eventually include on the website. And next slide will give you a sense of kind of the eligibility criteria. We want to promote positive youth development, programs that have been purposely designed for Native teens, that embrace cultural teachings and learning styles, and that have been evaluated by your community or programs. So please be on the lookout for programs and let us know if you think anything might meet those criteria. And next slide. We also have a couple of activities going on to encourage folks to use curricula on the website, so this is perfect timing. Happy Native Heritage Awareness Month. Next slide, where you have a back to school challenge going on, and just select any of the programs that are available on the website and implement it with a group of students. And you can click on a feedback form, which is available almost on every page of the website. And next slide will show you kind of the first section of that feedback form. If you fill out that feedback form between now and maybe the first week of December, we'll be sending out prizes to folks who submit feedback about implementing a program on the website. Next slide. So the first 10 entries will get $250 in school supplies, and all participants will get We Are Native and Spawn Safely promotional materials. And I know for a fact that there are remaining slots available. So take a look, select a curriculum, implement it, and even if you're in the process of implementing it, you can fill out the feedback form and be entered to win one of many great prizes. Next slide. I will kick it over to Jennifer Torres.
Hi, everyone. This is Jennifer Torres Jones. It's great to be a part of this panel. I'm going to be covering one of the curricula on the Healthy Native Youth website, and that's Native It's Your Game. So a little bit about the background of the team who developed Native It's Your Game. It was a collaborative partnership between the some tribal organizations in Arizona and the Pacific Northwest in Alaska, and then the University of Texas School of Public Health, where I am. Next slide. So when you click on the on the Native It's Your Game tab via the Healthy Native Youth website, you will come to the little introduction page, which Stephanie explained, and you get some snippets and a summary about what the program is and a few of the features. It's free. Training is not required. Anybody can kind of implement this. And it is an HIV, STD, and teen pregnancy prevention program for middle school youth who are American Indian Alaska Native, so around the ages 12 to 14. And so it can be implemented in the school, so in the classroom, or also extracurricular programs. So it could be an after-school program. It could even be at home if parents are interested in taking their own kids through a program that's definitely capable of being implemented anywhere. Next slide. So to get to it, once you have clicked on the tab and you want to learn more, if you go to that lessons plan tab on that intro page, it will bring you to this page, which is the kind of how you sign up for an account and log in to access the lessons. So again, all you need to do is sign up for an account. You don't need anything extra. It takes less than 5 minutes. And this is where both facilitators and youth access the program. So if you are a facilitator or an adult hoping to take some youth through this program, you would sign up for an account, and then it would actually enable you to have a kind of a virtual classroom where students can be added to your classroom and you can track their progression throughout the program. There are 13 lessons and they're about 30 to 50 minutes each. So when you go into this, you will see all of your students that you've added or that have enrolled in your classroom, and then you can follow along how far they're progressing through the program. You can also access their grades to quizzes that they take at the end of the lesson. Those are optional, but facilitators might choose to offer their youth some of those quizzes, and then they can just keep up with their group of kids. As far as youth enrollment, there are 2 ways that youth can enroll into the Native It's Your Game curriculum. They can sign up themselves, just like they would with any other account, and then add themselves to an existing classroom. So they would have to know their teacher's name or the name of the group that you created. Or as a facilitator, you can set up your own student profiles. So when you start your group, you can create profiles for your students and give them usernames and passwords. A little bit more time consuming, but worth it in the end if you want to have everybody's username and passwords so they won't lose them every day. Next slide. So this is just a snapshot. Once you get in and you see a list of the lessons. Again, I said there are 13 lessons, and they take 30 to 35 minutes each. And so it's a mixture. The curriculum ranges from topics from healthy friendships, healthy relationships, puberty and reproduction, HIV, STDs, pregnancy, refusal, communication skills, and contraception. And so covering all those topics, we use a mixture of videos, different interactive activities like games, quizzes, animated scenarios, and also journal activities. And so the kids get to go through an experience that also is tailored to them. At the beginning of each lesson, they're asked, which gender do you identify with most? And they're asked that before each lesson. So it really does allow it to be LGBTQ inclusive, because not only can they choose gender and they can choose a different one on different days, but they also get to choose their partners for role plays. So when they're doing their practice skills, when they're doing scenarios, they can choose their own partners to practice with, and it's not default by whatever gender that they choose. Next slide. And so as I mentioned, this is, or maybe I didn't mention, this is an adapted program. And so our team adapted the program and went through a long process that if you'd like to know more about, you can access on the Healthy Native Youth website in the cultural relevance section. And we went through a lot of changes as far as making it more culturally relevant for American Indian Alaska Native youth. And a few of the things we did, I'll highlight here. We definitely added in Native youth. We redid all the videos of the peer videos so that they could just see kids who look more like themselves. We added elders and then a health educator who reflect tribal and youth perspective so that things could be set in a more cultural context. Next slide. And so just another example of a cultural adaptation is we redid a few activities, and this is one of the ones that was redone by our Alaska partners. And this is an activity about elder wisdom. It has the grandpa and the grandson, and they're fishing, and they're having a talk really about life, but really about the grandson's decision to take his relationship to the next level. And so one of the things that we wanted to make sure to do is frame pregnancy prevention in a good light, so that it's not seen as teen pregnancy isn't seen as something negative, but that it's just seen as a life choice as far as when you choose to engage in sexual activity as a personal choice and a life choice. And then in this particular story, the grandfather goes through pros and cons of waiting or choosing to have a family now. Next slide. So those are just a few highlights. We really encourage you to go check it out. I'm going to talk a little bit more about the actual study. So when we adapted it, we tested Native IYG game, and there were 2 study arms. The intervention study arm that got Native IYG game, and then the other group got a suite of health-related online kind of programs that weren't related to sexual health. And so we had 25 sites. They were randomized to one of the 2 study arms, and again, they were in Alaska, and then Pacific Northwest, and in Arizona. And we had about 574 middle school youth enrolled, and we conducted pre, immediate post surveys, and 12-month follow-up surveys. And next slide. And we got some good results there. So the youth who took Native IYGs reported that they had more reasons not to have sex, increased STI knowledge, increased condom knowledge, more confidence obtaining condoms, and more confidence about using condoms. So this is compared to the students who didn't receive Native IYG. And we're also working on the 12-month results right now, and it's not available to be publicly shared, but I can say that we did sustain some of those positive condom outcomes as far as knowing about condoms and being confident about obtaining and using them. And so again, please check it out, and thank you. I guess next slide.
Hello, my name is Nicole Tewitt, and I am a Senior Professional Research Associate with the Centers for American Indian and Alaska Native Health here in Denver, Colorado, at the Colorado School of Public Health. And I am here to talk to you about a program that I was involved with evaluating the impact of, called the Circle of Life program, or MCOL. The M stands for multimedia. Next slide, please. So just a little bit about the Circle of Life program. So it's an evidence-based program that was originally developed in the 1990s to address sexual health risks among American Indian teens. The program was originally developed specifically for indigenous populations, so it wasn't necessarily adapted from an original intervention. It was something that was specifically catered towards, developed for Native American populations. And we received, or in the 90s, it received an extensive amount of input from Native American health educators, community members, and elders. And then in 2010, Office of Minority Health and a team of members here from the Center for American Indian Alaska Native Health at the University of Colorado adapted the program to be an online format, which is where the multimedia, the MCOL title comes in. So the multimedia Circle of Life program is for American Indian youth ages 10 to 12 years old. So we're focusing on this younger age group prior to the onset of sexual risk behaviors. So before they reach high school and start to begin to engage in sexual experience. So the program essentially is designed to increase knowledge and self-efficacy. These are factors that have been shown to reduce sexual risk in later years. So when youth do begin to initiate sex. So we just recently did analyze our data from our study, and we found that the MCOL program increases HIV and STI, sexually transmitted infection knowledge. It increases self-efficacy to avoid peer pressure, and it also increases self-efficacy to refuse sex and self-perceived volition. So we did show that a lot of these precursors to sexual risks, protective precursors to sexual risks, did improve as a result of the Circle of Life program. So the program consists of 7 online sessions that take about 20 minutes each, and all of our materials are available at the Healthy Native Youth website. Next slide, please. So when you go to the Healthy Native website, this is our homepage. So you'll have an option to choose whether or not you're a student or whether or not you're a teacher. So if you were to select the teacher side, or teacher, the teacher option, if you want to move on to the next slide, please. The teacher option, this is what you'll see. So the teacher option will provide you sort of an overview of the program. It essentially has all the information that you need to actually implement the actual program. So there are some tabs on the left-hand side that are used for navigation. There's information about the program. We also have some YouTube videos that sort of go through each lesson, go through all the materials that you use, that you'll need underneath the COL program tab, and then, excuse me, underneath the teacher resources tab. And so the lesson plans are also located in under the teacher resources tab, and then along with the YouTube videos. And then when we tested the program with the Native Boys and Girls Club with whom we worked with for our curriculum, the leaders actually said that the YouTube videos were actually really helpful. So not only did they have these written materials, but they had these videos that went step by step of how to implement the actual program. And then the actors that are in these videos are from the respective communities that we worked in. So that's interesting and engaging as well. So if you want to move on to the next slide, please, slide 34. So if you were to select the youth option, this is what you would see. So the last slide showed you what the teachers would see, and then this slide shows you what the youth will see. So you'll register here, so you'll create a username, your password, and then you'll select the state that you're from, and then also the age. The states correspond with different regional themes that are used for the background. So the orientation of the medicine wheel will be slightly different. There will be different Native images that are unique to respective regions of the country. If you want to move on to the next slide. So this is essentially what, once you begin the curriculum, whether or not you're a student or you're a teacher, you'll get a list of the 7 lessons that that are part of the program, and each lesson includes interactive components, which makes it best for each person to go through the program independently. However, we have had some sites do the program as a group. They projected it on an overhead group, and it was just as successful. So this slide lists all the 7 programs. So the first 3 lessons 1, 2, and 3, have to be completed before you can move on to the other lessons, 4, 5, and 6. These are essentially the foundational concepts, sort of the core concepts of the program. So we talk about what the circle of life is. We talk about adolescent development and making healthy decisions before moving on to the other section. I'd like to point out that while we do specifically focus on sexual health, there are some lessons that incorporate issues around substance use, because in previous studies that we've done, we've seen a connection with substance use and sexual risk taking. So it's pretty comprehensive in that sense. So you'll get both sexual health and substance use. So the last 4 lessons you can go through in any order. So you can talk about making choices, or learning about HIV, or lessons about the disease in any order that you would like. If you want to move on to the next slide, please. So in addition to the lesson plans, there are also discussion topics that we provide in the Teachers Resources area to sort of supplement the lessons. So what mentors, teachers, or group leaders, whoever's leading the lessons, can talk about in addition to sort of reinforce what is taught through the actual curriculum. We provide those. And then also there are some games for youth to play. This is an example of one of the games related to decision making. And as you can see, all the characters in these games are Native American. So they are adapted to the specific population. So this is an example of the games. Essentially, all 7 lessons that are available, there's at least 1 or 2 games associated with each lesson. If you want to move on to the next slide. So this shows an example of what the lesson plans will actually look like. So this is sort of the cover page of the lesson plan. We provide the objectives of each lesson. We provide an overview of the online material, so just essentially a summary of what the lesson has. We also kind of create sort of an agenda of how long each section will take, or how long we recommend it to take to stay within that 20-minute time frame, which we found to be most effective with working with such a young population. We also have the materials that are needed to actually implement the lessons, and so for this particular one, you'll need lotion and glitter. This was a fun activity. And then we also give you pointers on how to prepare to implement this specific lesson. And so for chapter 4, lesson 4, we thought that it was important for you to review the questions, and then just things like printing the worksheets out for youth in advance. So that's just a brief summary of what the Circle of Life is about, and then also sort of the curriculum that's available on the Healthy Native Youth website. Thank you.
Hi, my name is Amanda Gaston. I'm from the Zuni Pueblo in New Mexico. So I think there are 2 presentations left, which I'll have to zip through to make sure we have enough time for the next presenter and then questions. So this is the newest addition to the Healthy Native Youth website, responding to concerning social media posts. Next slide, please. So the new 1-hour training is designed for adults who work with Native youth, and this includes parents, mentors, teachers, coaches, health educators. During our research, youth disclosed they often viewed concerning posts online, but they didn't always know how to respond. They said they wanted support from trusted adults, like you guys. So, however, when we talked to tribal health educators about how they felt about this, only 5% felt adequately prepared to respond. So that's why we created this training for any adult who has contact with Native youth, regardless of their role or experience. The training will prepare adults to help youth who post or view concerning posts on social media and connect them to appropriate services. Next slide, please. So emerging research suggests that nearly 1/3 of American Indian Alaska Native youth see concerning messages on social media on a daily or weekly basis. These include posts that express depression, grief, intent to hurt oneself, or intent to hurt others that have been posted on social media sites such as Facebook, Instagram, Twitter, or Snapchat. Next slide, please. So as you know, suicide prevention remains challenging among youth, as many do not disclose thoughts of suicide before making an attempt. However, emerging research suggests that youth may disclose depression symptoms and suicidal ideation via social media. These public discourses may provide new opportunities to identify youth at risk and connect them to appropriate resources and support. Next slide, please. And these posts are surprisingly common. Over a quarter of young adults post references to depression symptoms on their Facebook profiles. Next slide, please. And as a trusted adult, our goal is to ensure that you feel prepared when a young person approaches you about seeing concerning posts on social media. And next slide. So this is just a screenshot here from a slide in the training, but included in the 1-hour training is a 30-minute video. And this prepares adults to help youth by giving them an overview of concerning posts, stories from families who have experience with concerning posts on social media and suicide, interviews from youth and mental health professionals, as well as the research that went into developing the video, including recommendations for how to interact with youth using a 3-step plan we call the Viewer Care Plan. So the training is built around the video, which reviews video highlights. It provides interactive slides for better retention and encourages community engagement to support youth using the Viewer Care Plan to help youth in need. Just to note that there is language in the video that may be triggering for folks who watch it. So we do encourage folks to please talk with a trusted friend or family member or a local mental health professional. We do have a clinical psychologist, Dr. Ursula Whiteside, who has been working with the Thrive Project since 2015, who is available, and we do list her contact information on the training. Next slide, please. So included in the training are support handouts. These include an overview for a participant that gives tips and examples for identifying suicidality and how to talk about it, along with the Viewer Care Plan. There's also flyers for receiving more low-cost and free trainings included as well. Next slide. And then also included are some Thrive suicide and bullying brochures that you can share with youth and folks in your community. So all of the training handouts can be found under the resource tab on the training, and they can be downloaded and printed from there. Next slide. Also attached as a resource, we created a community awareness activity that you can use to raise awareness about this topic with youth and adults in your community. It can be used just about anywhere, at school events, at a staff meeting, a tribal council meeting, or at tribal gatherings. So depending on the amount of time you have, you can show the concerning post video or just do the role play activities that are described in the activity guide. We also have a youth activity, which includes a role play activity, but it does not include watching the video. Next slide, please. And so this is just a snippet too from the training on some of the tips that we give for responding. So if someone does come to you with a concern, we suggest that you try to respond quickly. This is essentially true if youth reach out to you via text message. Give them lots of reassurance so they know they did the right thing by reaching out to you. You can say something like, "I'm so glad you noticed this and shared this with me. Thanks for coming to me. You're so brave for speaking up." And then be clear about your role moving forward. You can say something like, "I'll follow up with your coach after practice. I'll talk to their school counselor first thing tomorrow morning. I'll call their mom now. You did the right thing. I'll take it from here." So most importantly, we stress that you take the responsibility off the youth to respond. You are better equipped to get help than they are. And last slide. So we also have a YouTube video which is included in the training, and this shows what a live text message between youth and adult can look like. The intention is that adults can see what it looks like to put the video training and the viewer care plan into action. So thank you for your time. Please, of course, share this resource widely and freely. We know social media is here to stay, and we want to make sure that we are taking care of our youth as best as we can. Thank you very much. Next slide.
Thanks, Amanda. Hi there. My name is David Stevens. I'm a nurse at the Northwest Portland Area Indian Health Board. And as Amanda mentioned, social media is here to stay, and so is text messaging. And I'm going to be sharing a few projects that we're working on here at Healthy Native Youth that we are marketing and sharing through our sister site, We Are Native, which is directly marketed to Native youth. And as cell phones have become ubiquitous among teens, text messaging has become a promising tool to promote adolescent health. Mobile phones are portable, real-time, affordable, asynchronous, they're personal, possess one-to-many capacity, they're interactive, and above all, convenient and fun. So given an average text message open rate of 98% versus just 22% for email, and the anytime, anywhere capability of mobile devices to receive text messages, interventions delivered via SMS have the potential to reach an incredibly large audience. Through our We Are Native channel, we have over 5,000 subscribers that have signed up to receive weekly health tips. And we've sent over 417,000 text messages and received over 17,000 text messages since moving over to our new service in December of 2016. And this is our weekly health tips text message service that youth can sign up for by texting NATIVE to 97779. Next slide, please. So each month we focus on national health observance. For example, last month was a focus on bullying prevention. And we posted a series of messages to improve youth's confidence intervening in situations of bullying or violence. So the sequence started with a message, see bullying, want to help, but don't know how. Text more to learn how to be more than a bystander. And as you can see here, this is the message series that youth could engage with and learn additional tips. Next slide, please. Another one of our focused text message campaigns has been on wellness, and the Texting for Physical Fitness program can be tailored to the interests of the individual. It can be disseminated broadly regardless of geographic location and can be accessed when and where the individual is ready by texting fitness to 97779. Next slide, please. So once signed up for this service, text messages are personalized and participants can select either a male or female training buddy to take part in 6 wellness challenges. Next slide, please. So they set a personal wellness goal and are asked if the challenges and goals were met. Some preliminary results show that about 84% of all wellness challenges were completed, and 72% so far have indicated that they've met their personal wellness goal. So we're really excited about those numbers. Next slide. We offer ways for youth to further engage in the message series, and also in addition to the text, we also include emojis and also other multimedia videos that youth can engage with. Next slide. Some of the best practices for text message also include personalizing those messages and making sure that the messages don't appear to be coming from a robot. So we try to make those text messages appear to be coming directly from their training buddy and an actual person on the other end. Next slide. Participants are also offered daily movement reminders. And again, preliminary data shows participants who were more engaged with the text message series actually show improved outcomes. So almost 90% of all challenges were met by subscribers who enrolled in the daily movement reminder. And we try to keep it fun as well with those images. As you can see, plank level, that baby is an expert. Next slide, please. We also have a Texting for Sexual Health campaign, which youth can subscribe to by texting condom to 97779. Subscribers receive a 12-week message series that has shown to increase condom use and also improve STD and HIV testing behavior. Next slide, please. And as this is Native American Heritage Month, we are encouraging youth that you know to text One Nation to 97779. Once enrolled, youth are prompted to submit a selfie and share why we are stronger together, and they can win up to $75. And on Native American Heritage Day, which is November 24th, we'll be sharing all of their images in the Stephen Paul Judd collage using hashtag Many Tribes, One Nation. Next slide. Here are a few ways that youth can directly engage with We Are Native. Follow us on these different social media channels. For those weekly health tips, contests, and life advice, they can text NATIVE to 97779. We also offer a community service mini grant that is directly for youth. Youth can apply for up to $475 to make a positive difference in their community. And youth can also apply to be a We Are Native Youth Ambassador, and that application will be opening up in the spring. Next slide. Some more ways to get involved as health educators and adults. Share the site with your community networks. The URL is healthynativeyouth.org. You could also sign up to receive updates about the curricula available on the Healthy Native Youth portal. There's a red bar at the bottom of the homepage that you can enter in your information, and stay connected with us on social media at facebook.com/healthynativeYouth. Next slide. Healthy Native Youth and both the We Are Native program are funded by IHS HIV and behavioral health programs, and also supported in part by the Secretary's Minority AIDS Initiative Fund. Next slide. I want to say thank you all, and we'll turn it back over to Elton for any questions.
Elton, excuse me, unfortunately we can't hear you.
I want to thank all the presenters for their lovely presentations in honor of Native American Heritage Month. So we're very excited to be able to celebrate Healthy Native Youth 1-year anniversary as well. So thank you to our presenters. We do have several questions here. The first question is for Tommy. The question is, 23% male responded to the text survey. Is there a reason or theory you can come up with regarding the comparison between female, over 70%, and the male respondents? Surely there's no right answer, but interesting to see the difference.
Yeah, that's an excellent question. And when I present or when I do these, outreach, it's kind of a trending theme that females are always, the first ones to volunteer, the first ones to sign up for any contest or messaging that we offer. So there really is no definite answer in this situation, just because I always again joke that us males are a little more stubborn, and we take a little more time to get convinced to either fill out an 8-page survey or a 1-page survey. So again, just I'm looking at David here through our research and other various messaging campaigns. It always seems to be the female population that is more engaging, and that's one thing that I'm kind of setting the personal goal of, is getting more males involved in other various campaigns that we have here. So again, there is no definite answer. If I knew it, I wish I would share it. So
thank you. And the next question is for Jennifer. Jennifer, this is a two-part question. Does Native It's Your Game work well on phones and tablets? And are the youth supposed to be all in the same room when they do Native It's Your Game?
Oh, great questions. Thank you. It is not really supported by phones. We're still kind of working on that, and hopefully, as we get, if we get another set of funding, we can fix that. But as far as tablets, they work on all tablets except for iPads. We also have some kind of software things that we're working out there. So any tablet except for iPads, and unfortunately not with cell phones. As far as being in the same room, they don't have to be. It might be helpful as a just going through a classroom experience, and to be able to monitor and make sure that they don't have any questions or aren't getting stuck or aren't on other websites. But it's definitely not a necessity that they're all in the same room.
Okay, thank you. Nicole, the next question is for you for the Multimedia Circle of Life curriculum. How do you define self-efficacy, besides better able to resist peer pressure or refuse sex? In other words, does it come from a mix of sexual knowledge and more confidence?
So sexual knowledge is actually separate. So self-efficacy is just essentially whether or not youth has the belief that they can resist sex, is how we use the definition. Is that helpful for you? Does that answer your question? Oh, you can't.
Yeah, I believe so. But we can, follow up to the questions if you have more definitive answer for them. The next question is for David. David, did youth help develop the monthly text messaging content, or was that pulled from one source and then delivered?
Absolutely. Our program strives to be for Native youth, by Native youth. So all of our content on the website has been reviewed by Native youth, and we have a great group of youth ambassadors who we frequently pull for that content and bounce ideas off of as well. So the monthly focus of those national health observances is a mix of both medically accurate resources and trusted resources, in addition to youth-reviewed content.
Thank you. And as time's winding down, we have our last question for Stephanie. For the concerning post-trainings, how do you address the gap between youth who participate in the training but reach out to an adult who has not received the training?
Yeah, that's a great question. We are kind of going at it from two angles. We are both educating youth to reach out if they see concerning posts, and also through the webinar that Amanda spoke about, equipping adults to respond to those situations. So to prepare youth to raise the issue when they see concerning posts, we have been using the text messaging service and We Are Native's Facebook page to encourage young people, if they see concerning posts, to reach out to trusted adults, and giving them kind of some steps and tips to kind of not judge those concerning posts about whether it's true or drama, but take everything seriously and report it. And through Amanda's concerning post training, equipping parents and adults to use the viewer care plan to help youth who are in those situations.
Thank you. And thank you again for, to all our presenters who are able to present on Healthy Native Youth. Please reach out to the information for the Healthy Native Youth Project online, Twitter, social media, and also for the Office Minority Health Resource Center. Again, thank you for everyone who was able to participate on this webinar. We were honored to be able to celebrate Native American Heritage Month with this webinar, and continued success on the project and the good work that everyone's doing for our Native youth in our Native communities. Thank you again. Yeah.
Hooray!
Thank you, everyone.
Thank you, everyone.
Thank you all.
Thanks for coming.
Thank you.